also be a small patient journey. So once the patients come in, they will be greeted at the reception. They will wait a little bit here. Here you will see the nurses' station. And we try to keep it a little bit more private as we go into the treatment area so that people in reception cannot see what the couples are doing. Here we have 2 of our consultation rooms. In total we have 8 plus some to be converted. So, and you can come in. And what I would like to show you is and we're very proud of this state-of-the-art ultrasound machines because, as I was explaining to His Highness, we are the only clinic in the GCC to have so many of these expensive models of ultrasound machines connected to TVs on the wall, and this goes together with the state-of-the-art incubators we have in the lab, as we'll explain. I'm saying this because it makes a huge difference to the patient's psychology to understand when we are doing the scan what we are seeing, because they can see as well, and it makes a big difference in the success rates, because, and this goes, the credit goes to our investors and the management, meaning that they invest for that little extra 2, 3, 4% success rates that every new machine does. But this is babies. This is babies. This is happy family. So I cannot stress this enough because they're putting their sweet money, the funds into this, and it makes a difference in babies. So that's why I want to talk about that. The other part that makes a big difference is the pharmacy, meaning that couples don't have to run outside to collect medications from other pharmacies. When they leave the clinic, they have everything they need to go home. And this is also like, it adds to the convenience, because IVF is a difficult journey, and we want to make it as less difficult and more convenient as possible. So, going down the line, we have core consultation rooms, also state-of-the-art machines. Treatment rooms here when we need to take blood pressure and pulses and all the necessary like treatment plans. But you see, it's far away from the waiting room. We don't want to add to the inconvenience. So here more consultation rooms. Behind we have the nurses station where the nurses can concentrate and type all the treatment plans and all the nursing notes. And looking from this side, the management offices, the IT rooms. Now today we use them for preparation. Now we're moving a little bit more into the deeper IVF areas. Yes, I would like to introduce our lab director. This is Stanley Suli. We're not allowed to go inside the theaters because we're not sterile and inside the lab, but we want to explain to you what I said about the equipment and what they do in the lab. So I'll give it to you, Stan.
Yeah, so here you can see all our equipment. So this is our Andrology lab. Here we do all our semen analysis and sperm proofs. And as you can see in the picture, we've got 3 embryoscopes. So all our patients get cultured in the embryoscopes. So that's an undisturbed environment where we don't have to open and close incubators to look at the embryos, which is a favorable thing. And then we do embryo transfers. We do biopsies of all our embryos, genetic testing, basically all the procedures that, yeah.
So what I was just saying is these, especially these 3 machines, but the whole lab equipment is the most expensive, but it's not because we just wanted to spend the investors' money. It makes a difference. And then you ask sometimes in our conferences, well, that one is equally good. It's not equally good. That 2-3% will mean more babies. That's what Orchid is about. That's what Orchid is about. I always like to stress that because when you will hear in my speech, whenever we fight with the management, no, we need this machine, but why don't you take this one? We have to always go for the best ones. Like if we don't compromise there, the revenue will come because we'll make more babies. So that's what we are all about. That's what we're all about.
Thank you.
And I wish I could show you the operation theaters. We'll go there, but this is also super perfect, state of the art. So, this is our operation theater complex. We call it a complex because you can see we have all these recovery rooms where patients can feel a little bit more privacy. As you can see, many clinics have a bay and curtains separating the patients, but for us, it's like a separate room, each couple, so that they can talk after the operation, so we can also explain how was the embryo, how many eggs, how were the eggs, how did the operation go. This is important so that the other person cannot hear behind the curtain. So privacy is very important, especially in our specialty. You cannot go through the door, but there we have two super modern operation theaters, and very few clinics have two theaters. It makes our job easier because as we get busy, in one side we can collect the eggs, on the other side the other doctor with sometimes a second anesthetist can perform a gynae procedure, or we can do an embryo transfer without having to push our cases in the afternoon or the evening. We can work in parallel. In the previous clinic we didn't have this. Now this is new, and now we have the experience to get organized like this. The other machine I cannot show you, as anesthetic machine, is the latest. Like it costs us 170,000 dirhams, but it's like the Ferrari of machines. The Ferrari of machines. And it helps couples recover well. The anesthetic feel confident to give anesthetic, recover them. So I don't know if you have something to add.
No, that's it. I mean, he has summed up everything, you know. I mean, as I was talking to him also in the morning, here we have, diversified our patient's experience, you know. Somebody who is coming in for operative workup, you know, they do not have to be exposed to this group of people who are sitting for the clinical consultations. They have their own private setting here. They come here with a couple, they do the procedures, and they can be safe and
without being seen.
And then we have the OPD consultation.
That's also with VIP patients. Sometimes we get some VIP couples that don't want to be seen. They go from the back and they leave.
So we have a photo station over here.
Yeah.